Hello friends, welcome to the another episode of Decode ECG series. So if you see this given ECG, you will find strikingly that there are wide QRS complexes superimposed on normal sinus rhythm. So this is your sinus impulse and these are your wide QRS complexes, bizarre shaped wide QRS complexes which are not preceded by P waves. There is no P wave here. So these are nothing but your PVC. So how to identify PVC? To identify PVC, there are criteria. One thing, they should not be, there is no preceding P wave, no preceding P wave, and the complexes has to be wide, that is more than 120 milliseconds or more than 3 small square. Third one is ST and T wave changes. T wave changes are opposite to the QRS. So these are the criteria which you will call it when satisfied you will call it as premature ventricular complexes, or they are also called as ventricular premature complexes or ventricular extrasystole. So this is showing PVCs, and if you carefully observe, see, there is normal sinus rhythm and PVC, normal PVC. So every second beat is your PVC. That means this is ECG showing ventricular bigeminy. If every third beat is a PVC, it is ventricular trigeminy. If every fourth beat is a PVC, it is called as a ventricular quadrigeminy. Now when you identify it as PVC, you have to locate the foci causing these PVCs. So how to do that? So for that, first you have to see is whether it is on the right side or left side. For that you have to see lead V1. In lead V1, the PVC's QRS complex is predominantly upward or downward, you have to see. In this case it is this is PVC, and in this case it is predominantly upward in lead V1. So it is predominantly upward. So when it is predominantly upward, it is on the left side, foci is on the left side. And after identifying whether it is on the left and right side, you have to see the axis. What happened to axis here? AF is predominantly down, and in one it is predominantly up. So both are leaving each other. When both are leaving each other, it is called left axis deviation. So when it is on the left side with left axis deviation, the position of the foci is inferior posterior. So how to remember? Inferior posterior, IP has left axis deviation, IPL. So IPL is the mnemonic. Inferior posterior has left axis deviation. So IPL is the mnemonic. So this is how you have to identify the location of the PVC which is producing the VPCs. So hope you understood the way of locating the PVC foci. So for that you have to see, just to summarize, see, you have to see QRS in V1, whether it is predominantly positive or predominantly negative, that is predominantly up or predominantly down. If it is predominantly down, it is on the right side. When it is on the right side, there are three possibilities. It could be an outflow, right ventricular outflow, which is associated with right axis deviation. It could be right ventricular inflow near tricuspid area, then it is associated with normal axis, or it could be near the apex, which is having left axis deviation. Just how to remember? You just remember OR. R means outflow and R means right axis deviation. What if it is positive? It is on the left side. Now left side there are two things: anterior superior, posterior inferior, or inferior posterior. Inferior posterior is, as I told already, IPL, it has left axis deviation, and this has right axis deviation. So this is how you can approach the way to locate the foci which is producing the PVC. First you have to see V1, next you have to see axis, whether there is axis deviation or not. Hope you like this video. If you like this video, like, share and subscribe. Thank you.